Hi guys, and welcome to Cardiac Ultrasound Basics. My name's Steven. First thing is probe selection. So the majority of cardiac ultrasounds we're going to be using the phased array probe. This is what it looks like. The first view we're going to be getting is something called the parasternal long axis view. So for that, you place the probe just along the left side of the patient's sternum. I usually start in about the second rib space and slide down until I see the best view. The indicator should be pointed towards the patient's right shoulder. So this is the normal cardiac orientation if you're in a cardiology suite. We switch things around in the emergency department, so this is what you're going to be looking for. You have the left ventricle here. Right ventricle is going to be here closest to your screen. This right here is the aortic arch, and people refer to this as the left ventricular outflow tract, so that's the term I'll probably be using most of this video. And right here you have the left atria. So let's look at that anatomy side by side with the ultrasound and make sure you can identify everything. Right here you have left ventricle, right ventricle, aortic outflow tract, and then up here is left atrium. So let's look at the ultrasound just by itself. So make sure you can identify all those structures again, and we'll talk about a couple things you should always notice in here. First thing, you should see the right ventricle, the aortic outflow tract, and the left atrium should all be about 1 to 1 to 1. So if you notice that any of those structures are much larger than their corresponding structures, that would indicate to you that there's some sort of pathology going on there. The other thing you want to notice is just the overall squeeze of the left ventricle. Does it look like it's coming together well? And then finally, you want to see down here, that's the descending aorta that's actually in the back of the parasternal long axis view, so you should be able to identify that as well. Moving on, the next scan we're going to get is something called the parasternal short axis view. So to get that, you're just going to rotate your probe indicator just over here to the patient's left shoulder. You're going to be looking for something that looks a little bit like this. So this is the left ventricle here with the right ventricle in front. And you can see that the wall of the left ventricle is much thicker than that of the RV. Now, looking at it side by side with the ultrasound, take a minute and make sure you can identify all those structures. Left ventricle here, right ventricle here. So ultrasound by itself again, what are the things you should be looking for in this view? Well, the main thing is that you want to make sure the wall looks like it's squeezing all the way around. This is one of the better views to identify any sort of segmental wall motion abnormality in cases where you might have ischemia or something like that. The other thing you want to notice is that this interceptal wall between the RV and the LV is bowing out into the RV. So if you notice that it looks flat or that it's actually bowing into the left ventricle, that would indicate that there's some sort of pressure overload where the RV pressure is higher than that of the left ventricle. Moving on, this is going to be the apical 4-chamber view. So what you're going to do here, this is probably one of the hardest views to find, so don't be discouraged if you can't find it, but you're going to go about 2 centimeters below the patient's left nipple if they're a man, or just like right in the breast line if they're a woman. You're going to point the face of the probe up towards the heart, and the indicator is going to be towards the patient's right hip. This is the view you're going to be looking for, with the right ventricle here and the left ventricle here, corresponding atria up here. Looking at it side by side with the ultrasound, let's make sure you can identify those structures. So here we have left ventricle, here we have right ventricle, and then obviously right atrium and left atrium up here. Ultrasound by itself now, what are the things we're looking for in this view? So big picture is we want to see the left ventricle here and make sure that it's squeezing normally. So you want to see that it's coming together well. You can see that there you do catch a little bit of the left ventricular outflow tract here in this view, which would technically be called an apical 5-chamber view. Right ventricle size is another big thing you want to look for here. So you want to make sure that the size of the left ventricle to the right ventricle is less than 1 to 1. So if you see something that's over 1 to 1, that should concern you that there's some sort of process that's going on that's making right ventricular pressure higher than that of the left ventricle. The last view we're going to be looking for here is something called the subxiphoid view. So we're going to put the probe right below the patient's xiphoid process, kind of pointing up to where you think the heart would be, with the indicator pointed towards the patient's right side. So in this view, you get a little bit of liver in front of the heart, and that's what you want. You want to use that liver as a echoic window to see the heart a little bit better. And then right here, you have right ventricle first, then left ventricle, and the corresponding atria. So looking at that along with the ultrasound, take a second and see if you can identify all those structures. So closest thing right here is right ventricle, right atrium, left ventricle, and then over here is the left atrium. So ultrasound alone, what you're going to be looking for here is usually some collection of anechoic fluid right here between the liver and the heart. What that would indicate is that there's a pericardial effusion. As you can see in some views of the subxiphoid, you can get a lot of anatomy, so you can answer some other questions, but mainly this view is used to look for pericardial effusions. Okay, well that concludes cardiac basics, so get out there and ultrasound some hearts.